Bühlmann Laboratories is a Swiss in vitro diagnostics company based in Basel, and it was founded in 1976. During the course of the years, the company evolved, it became bigger and made itself a very respected name in the in vitro diagnosis business, especially for niche products. We at Bühlmann are very proud, really, that we were able to set standards and innovations in the medical field in various regions of research and of diagnosis. I would mention neuroimmunology. I would definitely mention allergy, where we offer the flowcast systems, that's basophil activation tests, that provide the best sensitivity and specificity for food allergies, for example. This is important because bear in mind that food allergies can quite frequently be mistaken for IBD or IBS. And of course, IBD is our major area of attention. There, first of all, we produced and now market the most reliable ELISA available. It has been kept unchanged since 2007. It has a very wide measuring range, which allows for either doing IBD and IBS screening diagnostics, but also it allows to perform therapy follow-up for IBD patients, which is a very important field of activity. More recently, we developed and marketed the only quantitative calprotectin rapid assay, the so-called calprotectin quantum blue assays. And very successfully, by combination of these two technologies, really, Bühlmann has become a leader and setting new standards for IBD diagnosis.
Inflammatory bowel disease is a chronic disease that affects about 2 million people in European countries. It comprises Crohn's disease and ulcerative colitis, and these are two chronic diseases that needs a close follow-up and treatment, and sometimes can be debilitating diseases. However, thanks to modern medicine, the prognosis of IBD over the last 10 to 15 years has changed dramatically, so such patients today can expect to live and enjoy a normal life. Calprotectin is a small molecule that comes from inflammatory cells called neutrophils. It is actually the most abundant protein in these cells, and it's in fact just the same amount of calprotectin in neutrophils as hemoglobin in a red blood cell. This protein is remarkably stable, so that the patient can do a fecal sample at home, send it by ordinary mail to the laboratory for determination of calprotectin. And now calprotectin, as a matter of fact, has made it into the guidelines of good clinical practice made by the European Crohn and Colitis Organization. The use of calprotectin is now in the guidelines of good clinical practice adopted by the European Crohn and Colitis Organization. Calprotectin is a very simple and inexpensive test to run, and we use it to differentiate IBS from IBD. That means that patients with abdominal discomfort, it's very useful to use calprotectin to identify those patients that needs a colonoscopy. As a matter of fact, in my hospital, we use it in all such patients to make sure that we don't overlook IBD. And a lot of clinicians still believe that IBD is a rare disorder, but as a matter of fact, it affects about 1% of the population, which is the same as diabetes type 1, that is insulin-dependent diabetes. Furthermore, we know that calprotectin correlates very nicely with the endoscopic appearance of inflammation in IBD patients. That means that we can use calprotectin to follow disease activity without having to do colonoscopy. And you know that patients really hate colonoscopy, and we should not forget that it's also a very costly procedure to do. It has been a goal for gastroenterologists to identify a patient that will soon have a relapse. And we know that calprotectin starts to increase weeks and months before it will be a clinical relevant relapse. That's why in my hospital we follow the patients we ask them to send us a stool test every 3 to 4 months, and if we see an elevated level, we contact the patient for further follow-up. We today have an alternative. Bühlmann has developed a quantitative rapid test, where the patient can come directly to the outpatient clinic with the stool sample, and the IBD nurse will run a test, and we will get the result within 15 to 20 minutes, which will be equally accurate as the one that is sent off for ELISA.
Bühlmann Laboratories, by providing on one hand side the ELISA for calprotectin and on the other side the quantum blue rapid test for calprotectin, has evolved into the leading in vitro diagnostics company in this field within the last 5 years. We also look into the future. Our goal is to work on the assays, to simplify them, to eventually reach a stage where we will be more patient near. The quality that we provide, which is our fundament really, is based in a Swiss tradition, our so-called Swiss high-tech heritage, which is, as we think, nicely symbolized by our company mascot, the Saint Bernard dog. And just like the Saint Bernard dog, Bühlmann Laboratories reflects these being a reliable, competent, unique and independent company.